Sure. Yeah, sounds good. Thank you all for joining us at 8:30 this morning. Again, I'm Mike Dergis. I'm a partner with Kristi Stepp, who you'll get to speak with a little bit later in Sigrid Solutions. So we're a management recruiting leadership advisory firm with a mission to really connect great employers with amazing talent. And so Ron Pasick, who's been doing Leaders Connect in Ann Arbor for 25 years, Rob?
Yeah, a long time.
Long time. Rob and Michael Cole, Bank of Ann Arbor, and Paul Reiser of TechTown, we got together about 3 years ago to put together this Leaders Connect Detroit program. And the idea is really to bring together leaders from across Southeast Michigan to make meaningful connections and hopefully meet people that you wouldn't necessarily run into in your daily, daily lives and daily interactions. And so over the past 3 years, we've put together, I was counting it up, I think we've got 9 events so far that we've done over the last 3 years, but it's been a variety of formats. We've done large panel discussions with some amazing speakers. We've done small, more intimate kind of lunches with 10 to 12 participants. And then we've even done a city learning tour. So we had a bus from Golden Limousine and Detroit Experience Factory, and we went around and visited a number of different sites in Detroit, and again, made some great connections, learned a lot about the city. Today's our first virtual event for Leaders Connect Detroit. I know Leaders Connect in Ann Arbor has been doing a lot of them, so it's a tried and true tested formula. But I think we've got a great panel that has come together, and really looking forward to hearing what everybody has to say.
Great. All right. Well, we're going to start out with Shirley, if you would take the mic, and then we'll follow with Kristi, and then David will go third, and they're going to tell their stories about sort of the human factor in the COVID crisis here, and then we're going to break into small groups where everybody will have a chance in a group of 3 to also tell their story, and then we'll come back and share some of the takeaways from this. And also, we're always looking at ways that people can help each other. That's the biggest thing for this is what are the opportunities here to either through your business or personally to help one another, be a resource, make new friends. So Chris, let's see, Shirley, would you like to start out?
Whoops, we got you on mute.
Got to hear you. You're on mute. Let's see.
There we go. I did that to just avoid any background noise. That's the first thing I learned during this COVID experience, is to make sure there was no background noise. So I apologize for that. I'm Shirley Kangler. I am very honored to be included in this extraordinary group, and I could not figure out initially why I would have been included as a leader, in that I work as an attorney at Jaffe, Raitt, Hugher & Weiss, and I headed for about 17 years our wealth transfer group, which is a estate planning probate trust, and one of my subspecialties has been elder law. I attended the University of Michigan Law School, and then went back to law school a few years later to get a master's in tax law. So I've practiced now 45 years, and I can honestly say it gets better each year. It's fun and enjoyable to continue to meet new people like you, but certainly the most interesting clients you can imagine. We're here to talk a bit about COVID and how it impacted each one of us. And because we are in different areas, it's had an impact in many, many different ways. And I've shared that with friends over this period of time, how they're faring, how they have modified lifestyles, and all of the self-reflection that has been going on. I can say that at the beginning, early March, I had heard that there was this virulent virus going around, but I had no idea that it would impact me. And I just didn't take it as seriously as I should. I have 3 children. My daughter kept warning me to be careful, Mom, but I did not take heed. I was still going to the office, going to the nail salon, shopping, and all of those kinds of things until very abruptly, March 16th, 17th, I got a call from a client who had been in mediation with for 3 or 4 hours that prior week. And she was very distraught, and told me that she had tested positive for COVID. And I mean, that really knocked me off my feet because I had been with her in very close proximity for 3 to 4 hours in a very intense mediation. So that made me sit down, regroup, and think about going forward. One was her concern for certainly the client, but the second was after I kind of balanced myself and realized that she was in a good position and she would likely be okay, I started thinking about what would happen to me, because that certainly is an issue. We didn't know much about the virus, what it could do to you, how it could impact your life. And then I started thinking about my staff. We'd met at the office, and because we were mediating, we were moving from room to room and caucusing and going back and forth. So there was a lot of interaction with other support staff, other attorneys. And how do you handle that? So I made that very, very distressed call after I pulled myself up, assured my friend that she would be okay, and et cetera. Not again knowing that that would happen. I called, the first person I called was the head of HR to let her know, because I had no plan, did have no idea what was next. And then I spoke with my managing, excuse me, partner. And immediately that same day, we had to shut the office down completely and advise people that someone had been in the office that prior week, and they needed to take care to observe themselves, and we had to do a deep clean of the office. So that was on a Thursday, and we shut down that Thursday afternoon and did not reopen until that Monday. But I could not share who the individual was because it was a client. It was confidential, and you don't share medical information. So that period of time, however, I'm at home thinking I might have created a situation where others were infected. So I felt guilt. I felt very, very distraught. And then I was afraid. So I felt true fear for myself and my family. I mentioned I have a 96-year-old mom. And so I couldn't go see her. And I did visit her fairly frequently, although she has 24/7 care in her home. But I visited her frequently, and she would come for family dinner every Sunday. So that's kind of the personal side, the first week or so that I knew that I had been exposed. So I learned everything I could. I was concerned about my husband, who has a dental practice. He was still going back and forth, and I just kept thinking about all the people that could be impacted as a result of my one contact. We then, from the office standpoint, had shut it down, cleaned it up, notified staff. People were on alert. Some people who had comorbidities, other conditions, sought out their healthcare professionals, and efforts were made to try to figure out testing. Well, shortly after that, after we reopened for about a day or two, we got the governor's executive order that said the law office was not essential, so we had to shut down again. And we were shut down up until about 3 weeks ago. So we all started working remotely. And I can say just kind of a quick run through of, on the personal side, how it impacted the way my lifestyle. We couldn't see friends. I'm very busy, very politically involved. This is the height of political season. I formed an indivisible group. How do I keep up with 100+ women by email now? I didn't even know about Zoom. So I immediately had to learn how to use another method of communicating. I also had to be able to communicate with my mom, my children who are in different communities. So I learned about Zoom and started that effort. And for friends, we started having receptions using the Zoom as an opportunity to still connect. And as it related to work, after I kind of got my feet on flat ground, I started getting calls. Initially, that first week, there weren't too many, but then I started hearing about loss of individuals. And that was when the grief started, just the anguish, because I heard about friends. I had calls from the spouses indicating someone had passed away. In our office, someone passed away who had been a long, long time friend in the office, had been there as long as I had, 24 years. So that was very disturbing. But then I started getting calls for the work that I do. Clients who were working remotely or at home, or things shut down and they weren't working. But then they started thinking of end of life matters and what the impact of the disease could have on them and their children. And like most of us, the plans were either done but dated, or not done, or half done, or incomplete. So I started getting calls from clients who had given information 2 years ago, or we were right in the middle and life happens and they just stopped. Then I started getting calls from new clients, people who had faced challenges, people who had individuals who were COVID positive and hospitalized. So I started, instead of working kind of in the winter of my career, starting to slow down, I was working and still working 7 days a week and attempting to handle the calls. Now, I have to add the component of the office. We have a 200-person staff, and most of the office is in Southfield. We had to shut everything down and then start working remotely with only about 8 to 9 people who were the essential staff in the accounting area, IT area, who could go into the building. And it was amazing in that 1 week. It was almost like they had written the plan 2 years ago. They rolled it out, and we were all able to be up and running and working efficiently as an office, and continue that until we received the second EO, allowing us to open, but in a very restricted manner. And I don't need to tell all of you who are business people how that is working out. You can't have a full office. You have to continue to stay shut down to a degree. But it has worked out well with allowing us to, one, communicate with each other and support each other, communicate with our clients and provide services that are very, very needed at this time. And then also opportunities to continue to network with each other. And the last thing I'll mention is, even though COVID has this impact in our community, we every year have made a commitment to hire 3 or 4 summer law students, summer associates who are law students, for their experience in a major law firm. Some firms said they couldn't handle it because most people are working remotely, but our firm decided to go ahead and do it. We shortened the week, but we're still working with 3 law students, one from Wayne State, one from Michigan, and they are in the office, but working remotely with us. And I've had the good fortune of having the law students sit in on Zoom hearings, because courts are closed. So I have a hearing at 11 o'clock, and I have 3 law students who are going to sit in and observe. So we're still figuring out daily ways that we can continue to practice, provide the experiences, and certainly make life, even though it has changed dramatically for us, make life wonderful and value opportunities to serve in our community.
Sounds like it's been a dramatic spring for you in early summer. How's your mother doing? Is she okay?
My mother is well. She is doing very well. And because everyone was coming in with a mask on, or she'd look outside and see people with masks, she said, you know what? I think I'd better get a mask in case that COVID comes inside. So we left her some masks, which she doesn't have to wear, but she's doing well. Thank you for asking. She's doing quite well.
We have a 98-year-old mother-in-law that we're watching, and who's also in independent living. So it's quite a challenge.
It is.
She informed us last night that she was playing cards, even though she's not supposed to be. So. What are you going to punish her? You know?
That's right. What are you going to do?
Yeah. All right, well, well, thank you very much, Shirley, and we're gonna move on to Kristi, Stepp, and is it Stepp or Stepp? How do you pronounce it?
Like walking.
Stepp, okay. Kristi Stepp. So Kristi, you can try to follow Shirley's example. Well, she gave a very dramatic and stirring conversation. It's been quite an impact on her. So go ahead, please.
Yeah, it's wonderful to follow Shirley. She just sets a very high bar. Thank you, Shirley.
Thank you.
I'm Kristi Stepp. I have 30 years of HR experience, and I went to the University of Michigan. Seems to be a common theme across Leaders Connect, some touch here or there. I started my career with Pepsi Cola and have tried to leave Michigan many times and always end up back here. So some of those, I've lived in Dallas, lived in Atlanta, lived overseas for a few years, but every time we come back, and even with the winters and everything else, there is something that continues to pull us back here, and it's home. So COVID. I will share that, especially after living in Asia and hearing the impact of the bird flu and other types of pandemics, I had an idea of how bad this could be, yet really did not think it would come so quickly or that it would last so long. So in February, actually went on vacation and came back and started seeing, watching the media just really shift a lot. And by the time late February came around, my mother was very sick. She lives in Florida. And then I started to learn that some of my friends were getting sick. I have a number of friends who work in healthcare, and a couple of them actually lost their parents during this process. So that was very, very difficult. And I also learned that one of my friends has cancer. So trying to figure out how she was going to navigate through her chemotherapy and being able to do those things, and not being able to support her the way that I would have if I could just go over every day and be of support. So that's been challenging. I think the other thing was I made a career pivot. So after working in corporate for over 30 years, I joined Mike in Cigarette Solutions. And while I've coached people and I know all types of different change models, it's one thing to coach others, and it's another thing to hold up the mirror and have to apply those things to yourself. So one of the things that I had been used to for many, many years, especially after working in manufacturing or working in international organizations, was just a very busy and tight schedule. So up early in the morning, grab your coffee, get my daughter off to school, and then off to work, and meetings. Maybe I'd get a little lunch. And if there was going to be exercise, it was going to be at some facility. So either, the gym in the building or going somewhere for that. So going from that, I knew that there was going to be a difference. And a lot of times when you struggle, when you're going through change, really having realistic expectations helps a lot. So I had expectations, and I think they would have been realistic if I didn't have COVID layered on top of this experience. So when Mike and I started working together, we were able to see each other face to face and talk, and I really enjoy that. I really enjoy the face to face. I get a lot of energy from that. And I really got to the point, not just with work, but just with, I think, well-intentioned friends and organizations with a lot of Zooms and a lot of connections. And it became very exhausting at one point. And I was like, I just did not, I didn't mind doing a call, but I just did not want to be on another video. So I had to kind of breathe through and understand that. I also needed to I think just kind of deal with the fact that, you know, my close friends were very, very sick, and not really knowing how that was going to turn out was very challenging. And as they started to get better, as we were able to kind of get through, I think, the winter blues too, just that being in the house and not feeling like you could leave, and not being quite sure if you were going to go somewhere and get sick, was just very, very different. So at some point I really had to get used to the new normal of, I would say, more calm in the day, which if you're used to getting up, you know, early in the morning and running all day, that space can feel very unproductive. It can feel like you should be doing something of significant value with all of this extra time that you have now been granted, versus allowing yourself to breathe and be okay with the space that you've had. So it's easy for me to sit with any of you in a coaching session and say, you know what, you should embrace the time that you have. Yet for me, it was different knowing I had that space, but not feeling that that urgency to fill it up and check off a bunch of boxes so I could be proud at the end of all that was accomplished. Once, I think after my friends got better and I could see them, and I got over the Zoom fatigue and got more into a routine of, okay, I can't go to the gym. I don't know when I'm going to go to the gym again. I need to figure out something exercise wise. And through time, trial and error of figuring out, maybe I don't have to go to a gym to be effective. So what is that going to look like go forward? And getting into what I would call a new normal for now has been very, very good, to be able to find ways to support friends, even if I can't see them face to face, and really to appreciate that perhaps all of us in some way were operating at a pretty high level of anxiety all the time without a whole lot of space, because of whatever work we were doing, whatever our lives were. When you break situations and don't have the opportunity to do things, it really makes you reconsider what you do with your time and how you spend it. And I would parallel it to when I lived overseas and left all of the institutions and the things that I did here in the United States. When I came back, I felt like I was in choice. Now that was a different type of experience, but I didn't have to go back to the same church I went to. I didn't have to do the same things. I had taken leaves of absences from different organizations. I didn't have to go back and do those things. And I think COVID is kind of doing that same thing for us. It's creating space, and it's probably making us hold up the mirror and say, what are we doing with our lives? And is it of value? I will also say, I'll layer on a lot. I had to stop watching TV because with a lot that was happening in the world, especially with social justice and a lot of very personal pain, I needed to find a way to get information, but not have to be bombarded with it, because it was not good for my personal mental health. So I had to find a way of being able to have that, but not, and feel like I could do something with it without being bombarded with it every single day.
Interesting. I like the way you framed it as what are we doing with our lives, a new normal. We're all working on that. I could see a lot of nodding heads with that. Thank you very much, Kristi. We're going to go on to David. And if you have questions for the speakers, please post them on chat and we'll take them after we get through with all these three speakers. So David, how are you coping?
Day by day. You know, I guess one thing I would just preface my remarks with, you know, I sold my business back in 1995. And after the earnout, I left at the end of 1999. And since then, I've had to kind of structure my days myself. And so that wasn't a new experience for me. You know, I've always had to define, you know, what I was going to do each day, each week, each month. But with the specifics of this COVID situation, you know, let me just go back to, I didn't indicate personally, you know, my wife, Kishna, is here, and we're both pretty much at home most of the time. I have an older daughter, Stacy, who was working as a senior executive for Nike in China. And beginning of last year, I went over there, Shanghai, to kind of be with her her last week in China and experience the send-off party that her people over there gave her and that sort of thing. And it was timely, you know, her timing and deciding to move back to the U.S. Beginning of last year. She moved to San Francisco and took up a position there, got married last year. Her husband works for Google. She's working for a private equity firm in San Francisco. My son, my daughter's 35, my son's 31, and he started a position. He has a position in San Francisco with a healthcare technology firm. And so both my older kids were in San Francisco. I have a daughter who just turned 12 in April, Nadia, and she goes to Detroit Country Day School. So she had to make a transition this spring, which I'll get to in a minute. But so on the personal side, you know, we went to Jamaica for vacation. Like you, Dr. Rob, I decided to stop teaching in the winter and take advantage of that time to do some other things. And so we went to Jamaica in February, stayed at a place called Half Moon. We've been there a number of times. And it turns out that it was right before this pandemic situation got bad. And we were supposed to be going to Singapore, interestingly enough, Kristi, for my wife's birthday. She had a milestone birthday this year, and we had all these plans to spend time in Singapore. I too spent some time there for work. I had a distributor there and this sort of thing, and I was so looking forward to going to Singapore with my wife and my younger daughter. They have both never been, and we got close to, you know, that was going to be in early April, and obviously we had to put the kibosh on that. My son was getting married in Mexico in April as well. Actually, the week after we would have been in Singapore, we were going to come back and go to Mexico for his wedding, and they had to put that off. And they still have not gotten married, although they plan to get married when the Justice of the Peace, you know, when the civil authorities open there in San Francisco, and then we'll have a celebration next year. So, you know, it's amazing when you sit back and you think about all of the things in life that have been disrupted by this COVID crisis, and it's hard not to be angry about it, and, you know, to express political feelings about it. And like you, Kristi, I have to sometimes just turn the TV off and start watching YouTube videos or just do other things. You know, the effect has been just unbelievable. And when this whole thing got real for me, I was doing a radio show. We had I run this organization called Urban Entrepreneurship Initiative, and we were in the process of relaunching this spring. And we had an event at a place called Space Lab Detroit, which my niece actually owns. It's a co-working business in on Shelby Street in Detroit. So we had an event there on March 5th to kind of do a relaunch. And that was the last public event that was held there. It was right before, you know, everything got kind of shut down. I did a radio show the next day on WHPR with a guy that I met at that event. And I remember going into the studio and thinking, wow, this is close quarters here. I don't know, you know, and we talked about it. Do we really want to be touching anything? Or, you know, this is kind of a restricted space here. And I have a very good friend by the name of Brenda Perryman, who also had a radio show that same day. Every Friday, she had a radio show at WHPR. Well, it turns out she got sick. And I learned a couple weeks later that she was in the hospital with COVID-19. And Brenda is a very spirited person. I wasn't all that concerned when I heard about it. I heard, you know, she's sick, she'll be fine. You know, she's a very active person, very active in the community. She's a playwright. She's a radio host. She was a teacher in Southfield for I don't know how many years. Then one of my friends called me and told me that Brenda died of COVID. And it actually turned out she had a mother who's 100 years old in a nursing home. Her mother died the next day, COVID. And that's when this whole thing really got real for me. And since then, you know, I've known other friends who have gotten sick or died, or you know, it's really as I say, it's hard not to just despair and get angry about the situation. But in terms of professionally, you know, I'm kind of in a fortunate position because I didn't have any fires to put out. I have basically 4 activities. I'm teaching at University of Michigan, but not in the winter. So in the winter, I use that time to collect information and prepare for the fall. I'm on this team at University of Michigan, the curriculum committee for this new Detroit Center for Innovation in Detroit. And we started meeting in January with the president, the provost. There's a group of about 20 of us who are trying to define what that Detroit Center for Innovation looks like. We immediately had to go to strictly online meetings, and a lot of the community discovery, community engagement that we were planning to do, we had to do via Zoom as opposed to in-person meetings. As I say, we were in the process of relaunching this urban entrepreneurship initiative, and that activity got sidetracked because, you know, we really couldn't meet with the people we wanted to meet with. And then the other activity, that other main activity I engage in is investing, and that has also it's been kind of crazy with all of the financial engineering being done on a large scale by the federal government. As I say, no fires to put out, but just trying to manage those activities and to remain focused. Kristi, you talked about just having that extra time during the day and that downtime, trying to remain focused with that and keep moving forward. So there are 2 things that I try to focus on. One is building and nurturing what I call my personal infrastructure. And the second thing is building and nurturing that professional infrastructure, taking this time to really regird, you know, those systems. So on the personal side, there's a book I've been intending to read for the last 10 years called Infinite Jest by David Foster Wallace. It's about 1,000 pages. I read it. It took me 3 months to read this frickin' book, but I read it. And so things like that have consumed a lot of my time, biking around the community, on my exercise bike or my electric bike has taken the place of going to the gym. Again, you mentioned, Kristi, having to make a change there. On the professional infrastructure side, it's interesting that there have been actual activities to improve things. So with this urban entrepreneurship initiative, we've been intending to engage people on a wider geographic basis. And it kind of dovetails with my class also, because we do a lot of the same things in my class at University of Michigan, engaging these urban focused entrepreneurs in mainly in Southeast Detroit, but we're taking advantage of this time to really engage with people on a wider geographic basis now, both in terms of urban entrepreneurship initiative and the class. And so whereas we were strictly for the class at University of Michigan dealing with people in Southeast Michigan before, I just got off the phone last night with a CEO of an outfit called ShotSpotter, based in San Francisco area in California, as one of my urban entrepreneurs. They detect gunfire in urban areas, right? So this guy, you know, the CEO of this company is going to be engaged with the class. And I've always intended to set up some kind of online, you know, internet-based instruction for the class, but this has forced the issue. And so, you know, I think that's been a positive. I mentioned my younger daughter being at school, and she really embraced this move to, you know, I've heard a lot of horror stories about the move to online, but she really embraced this thing and thrived with the online education. And, you know, she's done like a video story about how the Detroit Zoo was coping with the COVID situation, and she used Loom to build her, you know, video and put all the different elements in there. Man, I haven't done anything like that myself. So I was pretty impressed with how seamlessly she moved to that situation. But I think there are two overall things, two things that have been layered on top of this situation that are just weighing on me. One is the you know, the death of George Floyd and the whole Black Lives Matter situation being layered on top of this COVID situation, and trying to deal with how can we really come out of this with something that's productive and not just divisive. That's weighing on me. So I don't have the complete answer to that right now, but with this urban entrepreneurship initiative, I'm trying to, again, take things in a productive direction and channel that energy and that rage in that direction. And then the other thing is just the overall political situation, as I say, of, and I will be political for a moment, because and Dr. Rob, you know, you teach organization development, and I've stressed how important organization development was in the development of my business. That kind of having access to the kind of expertise that you provide, and I don't think you could have a more striking example of the importance of management and the impact of management failure than what we're seeing. And it's just incredible to me that there doesn't seem to be a wide recognition of that. There's certainly, well, there is a wide recognition of that. There's not a near unanimous recognition of that. And so what that points up to me is that people just don't understand how important management is, and how costly it can be when management fails. And so again, I'm just trying to not be in despair about that, because I would expect that the recognition to be more widespread,
Yeah.
or more close to unanimous.
Well, I hope that we're able to exact a change here come November. If we don't, we're going to all be
Yeah.
in severe trouble, I think. So we're going to have to we're going to not have to, but we want to shift from the presenters to go into small groups. The presenters will also be in these groups, so you might join one of them in that group. But Emily, are you there ready to shift us in a few minutes to groups of 3 where people could share their own personal experiences?
Yes. Yep.
All right, so you will be transmitted to a new chat room in a few minutes, and you'll have about 12 minutes there. And then we'll come back and wrap things up. So, Makisha, you ready for a ride? Everybody. All right. So, introduce yourselves, and we'll go to those small chat rooms. Mike, why don't you share what Mike Cole, what happened in your group? How was that?
Well, I got to be in a group with David and Megan, a couple of friends of mine here. So, it was great. And we just shared more of our experiences. We talked a little bit about the overlying social justice issues that are, going on during this pandemic that David touched on a little bit. Megan talked a lot about all the travel things. She's a big global globetrotter here for her business and all the things that got canceled when that all went down. And then the banking industry as well. We talked a little bit, which is what I'm in. We got super busy when it first started because of the PPP programs. And so we were working 24/7 to help clients with that. And we've, had to stay open the whole time during this crisis as essential services. And then I did mention Marlo Stoudemire, who is a member of this group here. And he was really the first guy that I knew that passed away from COVID. So that was my first real just, wake up call as to like, this is serious.
I think one of the things that really struck me in this having this group meeting versus a group meeting we had similar to this last week in Ann Arbor is how real this has been for the Detroit community in terms of direct losses and direct experience. In Ann Arbor, very few people I know who have had direct experience of anybody they know getting sick or anybody they know dying. So this points out, I think, that the disparities in our society, and it's very dramatic because each of the speakers has had a very direct experience of knowing somebody. Mr. Stoudemire was part of our group, but in Ann Arbor, it's like a different world, and that 40 miles is just huge. And I think we could spend a lot of time talking about why is that. Lots coming out now about the quality of care and during the virus and the quality of care beforehand, but it is quite striking. Kristi, you want to talk about what happened to your group?
Yes, I think the first thing that was interesting is ended up in a group with Mike and with Greg and with Ron Stallworth, and we all know each other pretty well. So that was, pretty cool. And we were able to talk a bit about, I think, just the space of COVID and how it has slowed things down, and what, the difference between still being in an organization, being in a corporate environment, and how this is impacting people versus if you're in more an entrepreneurial space, how that is impacting you. And it's interesting because both Mike and Greg have been out of corporate. Ron had his own business for 5 years and then rejoined corporate. So we talked a bit about just, I would say some of the stress and anxiety that comes from that need to perform, and perhaps even leaders intentionally or unintentionally creating environments where there's more stress around what you are not accomplishing. So a butts and seats versus true outcomes. And Mike actually brought up a really good point of that busyness of being, up and in meetings and meetings, but really, what were your outcomes? How productive were you really? Did you feel really productive? Right. Or were you truly productive? Mm-hmm. And I think that's probably one of the questions that I think will be shining in bright lights as we move forward. What are your outcomes versus how busy have you been? Because I think what COVID has done has really highlighted what gets done, and that it reveals a lot of those things. So you can have an illusion of being quite productive and not being able to go into the office and do some of the other things really does show the outcomes, whether they're there or not.
Thank you. Shirley, you started, and I'm going to give you a chance to wrap us up too. I know people are having to sign off because of the time. But how was your group, and what is your takeaway from the experience today?
My group was great, but we'd like to have Markesia Pierce. Say it again.
Markesia.
Markesia Pierce. We elected her to be our spokesperson.
Okay, Markesia, it's my neighbor. Go ahead.
Markesia. Okay.
Yep, Markesia. Yep. So I was in a group with Shirley and Forrest, and so we talked a little bit more about how our immediate family was adjusting to us, or how we were adjusting to being in such close quarters to our family. So Forrest actually travels a lot, and out maybe 10 months out of the year, he's going so many miles and so many places. And we just kind of talked about how with this new situation, it seems like all of our priorities seem to kind of close in on us, because you're either looking at a Zoom screen, you go outside your office door, that's immediate your family. If you have an office door, they might just be right next to you. And it kind of puts this tangible perspective of, you have to pick your priorities now. They're all right here. Now, which one are you going to focus on in a way that we might not have had to do before? And just kind of being able to reflect on what that means, and just picking up on that theme of, you have to kind of be still, work through it, and prioritize a little bit different. And it's really making you do that a little bit more deliberately, if you will.
Well, that's a good summary. Thank you for joining us. Markesia, is it the right spell? Is that the right pronunciation?
Markesia, like the Marquise diamond. Markesia.
Okay. Gotcha. Well, anybody want to share, just to wrap things up? I think we've all had a great opportunity to hear from each other. I appreciate it. We're going to put some of this on a video, and if anybody has any thoughts they want to add to their comments, please do that. We'll make this available to the general Leaders Connect community through a YouTube, put it on a YouTube channel. So you can all have your own YouTube. So again, I just want to wrap up. I want to be aware of the time. Michael, either of you have any closing comments?
Just thanks, Rob, and thanks, everybody.
Yeah, thanks for joining and your participation. It was really, really interesting.
Yep.
All right, we'll be back. We'll be back.
All right.
For the next
Take
step.
care.
Thank you.
Take care.
Thank you. Bye-bye.